One of my favorite examples about how substantial these low-level exposures can be is secondhand smoke. So in Scotland, as well as in a number of other countries around the world, it was found that when smoking in public places was banned, there was a 15% reduction in preterm birth among non-smoking pregnant women. 15%. There was a 25% reduction in very preterm births, that is, children born before 34 weeks. Those reductions are better than any drug we have for preterm birth. And yet the vast majority of physicians I talk to know nothing about this, right? But that's just secondhand smoke. And that's just one chemical. What we know is that we are dramatically underestimating the impact of these toxic chemicals and pollutants on human health, whether it's death, whether it's autism, whether it's IQ deficits, because we failed to acknowledge it. We're focused so heavily on spending our money for new and expensive drugs, genetics, stem cells, that we aren't even giving any consideration, or certainly not enough consideration, to the things that we could do to actually prevent disease. Now, here's one of the things that parents could really help with, and that is to ask themselves this question. Would you rather rely on some new expensive drug for your child when they develop ADHD or leukemia, some form of arthritis, or you yourself develop complications during pregnancy or heart disease or lung cancer? Would you rather rely on those expensive new drugs with their side effects? Or would you rather we take steps today so that your child never has leukemia or that you never have coronary heart disease? Now that seems like an obvious question. There are no surveys about this out there in the world. Nobody's even bothered to ask these questions. I did ask this question to pediatricians, to over 1,000 pediatricians. This is over 10 different universities and hospitals and national conferences. I asked them, it was a hand-raising survey, I asked them whether they would either, one, vote to increase funding to find ways to enhance the cure for childhood leukemia, which is arguably the poster child for finding a cure, or two, increase funding to find ways to prevent childhood leukemia. And I asked them to think about their children and grandchildren before they answered. Now, most people, when I ask them this question, and I say, what percent of pediatricians do you think voted to increase funding to enhance the cure? The majority say over 50%, even over 70% of the pediatricians would vote to enhance the cure. But here's the thing, which is quite hopeful. 5 out of the 1,000 pediatricians voted to increase funding to enhance the cure. 5, less than 0.25%. So here's the tragic part of it. If you look at what the National Cancer Institute's program on childhood cancer spends on prevention, 1%. So the NCI is not representing what pediatricians prefer. I doubt they're representing what parents prefer. Why is that? Who are they representing? Now, it wouldn't be a fair question for me to ask that of a parent who already has a child with leukemia, but I would like to ask them a different question. Do you wish 20 years ago we spent more money to find ways to prevent childhood leukemia? That's the only fair question to ask them.